This is Healthcare Now, radio's trending now. Get ready for an exhilarating 30-minute ride through the latest topics driving change in digital health across the news and social media. Join us as our subject matter host takes the lead in uncovering what's hot and what's not. So buckle up and tune in to stay in the know.
Welcome to Trending Now on Healthcare Now Radio, where we explore the forefront of healthcare innovations and transformations. As usual, I'm your host, Shahid Shah. Today, I'm really excited to have Kelley Smith, co-founder and COO at Envision Health, joining us. What's trending now, and really what Kelley and I want to focus on, is this special month that we use to celebrate nurses. Now, of course, we shouldn't just have a special month, just like we shouldn't just have one special day to celebrate moms and dads. We shouldn't just have 1 month to celebrate nurses, but it gives us a good way to formulate and organize how that conversation goes. So what I'd love to do is to basically just have Kelley introduce yourself, tell us what you do, and what you think about this month to help celebrate nurses.
Well, thank you so much. I'm so excited to have this interview today. My name is Kelley Smith, as you mentioned. I have spent more than 3 decades in the healthcare industry, so I'm a passionate person when it comes to healthcare. I started my career a little bit differently than probably most nurses. I graduated, or I was actually my 3rd year of nursing school at the University of Michigan, came to the decision that I did not want to be a nurse any longer. And my parents were like, oh, that's interesting, because there's no other degree with all the science and math classes that I had that I could transfer into. So I would have to go back as a freshman. So we talked a lot, and they said, why don't you finish nursing school, take your boards, and then we'll help you with graduate school. So I stayed right on, went to the University of Michigan, and got my master's in public health and health policy administration. And then started my career actually at EDS, working in the General Motors area, for General Motors. So I was a consultant there for 9 years in both the employee benefits area and their healthcare cost analysis section. I worked very closely with management, and I was kind of an intermediary with the union, the UAW, because my paycheck actually came from EDS, not management, as they would say. It was a really great start to my career. I went through 4 different UAW GM negotiations, learned a lot about the healthcare industry. And then fast forward, I stopped working. I stayed home with my children for a few years. And then I thought, I kept my nursing degree all these years, or, my accreditation and all. What can I do next? And so I called a friend of mine who worked at Trinity Hospital, and I said, do you need someone that's, doesn't have a ton of nursing experience, because I haven't been doing it the last 9 years, but I believe I have the skills. So she hired me as a case manager. And so I spent a number of years as a nurse case manager, which was a wonderful opportunity, because you get to work with everyone in the multidisciplinary team, and including the patients and the families and the physicians and all the ancillary service providers that help care for that patient. So it was a great re-entry back into nursing. Did that for a number of years at several different hospitals. And then a friend of a friend called and said, we've got this technology company in Detroit called Covisint, and I need a nurse. And I was like, ooh, I'm not sure I'm ready to go back into that, different kind of environment again. But it was an opportunity that was too good to pass up. So I went in and I started in the pre-sales at Covisint, and quickly realized how valuable those nursing skills were, because I was sent with a team of salespeople out to do many different, prospecting engagements. And I would get in those rooms and I would think, oh my gosh, I don't know how we're ever going to get the closest deal, because they didn't understand all, the processes, the workflows, technology, what physicians or nurses or others would and would not use, in their day-to-day operations. And so my bosses finally said, okay, you are now going to be the presenter, which was not my ideal thought right at the time, because I traveled all around the country with the sales team, but the nursing provided such credibility that it's, instantly, if you say that you're a nurse and you've practiced, they're like, okay, you get it. You know what you're talking about, and you can help us. So that's what I did for a couple of years. And then I met my business partner right now, Tim Bush, and he and I were both very entrepreneurial. And he always wanted to start a company as well as I did. And he said, the thing is, if we're going to go into healthcare, I need a nurse as my partner. So that's how we co-founded Envision Health. And we call ourselves a clinically informed marketing and PR agency.
I love it. In fact, that entire journey that you went through, I wish more people went through those kind of journeys, because in healthcare, it's one of those few industries where you have to know a little bit about a lot in addition to one particular vertical. So if you're a nurse, you'll know everything about that vertical, but then you need to know about sales and how do you talk to people? How do you present? How do you actually do a project? How do you deliver the project? So that is all fantastic. And I loved the way that you described the clinically informed marketing and PR. So tell me a little bit about, what are your feelings about this idea of Nurses Month? And then we'll jump off on some topics that are tangential to that as well.
I think oftentimes nurses don't get the recognition that they deserve. And I think, well, I'll back up my story a little bit. Part of the reason I decided I did not want to pursue nursing was because we worked with we worked with all the medical students at University of Michigan, and they thought that they were the best. They went to this great school, but the nurses, we thought we were kind of pretty special too. And I found that at the time, and this goes back many years ago, but at the time you could choose from care plan A, B, or C. That was it. And I was always thinking, well, but what about D, E, and F, or G, or Z? And like, no, you're just a nurse. You don't make those decisions. And it really frustrated me. So I kind of pivoted and went into psychiatric nursing, because in psychiatric nursing, it's between you and the patient. You've got to establish the trust and have that bond so that they'll open up and talk to you. And so it's a funny, kind of flip. But anyhow, nurses do deserve so much credit. They're the first ones oftentimes that a patient meets. The nurses are the ones that will establish trust. And, when you're in a location like a hospital or even a clinic or a doctor's office, you've got nerves and you're scared, and you don't know what's going to come next. And sometimes the team will talk in words that are so far over your head you don't understand. But the nurse is the one that kind of holds the patient's hand, the family, tells them it's going to be okay, or sometimes it's not going to be okay. But you have to have that very strong trust with the patient. So I think besides the empathy and the trust, nurses are really smart, and they have to understand how to titrate medications and how to understand, if there's contraindications between different medications that maybe haven't been identified yet. And there's just such a need. And I give these, it's hard for me to say because I'm not practicing anymore. Although once a nurse, always a nurse. Mm-hmm. My family, my friends, they call me for every little issue that they've got. And I have enough knowledge now where I can go back and be dangerous because I know how to find those answers. But also nurses are creative problem solvers. You have to be. You have to be able to pivot on a dime. Things change. Someone might have a trauma or, crash or what have you. So you need to maintain that level of professionalism, calm, and always just help you. Like, you're the nurses are like, it's going to be okay. And I'm here for you. But I think the Nurses Week or month is really important, just to remind people of that very important role that nurses play.
No, I think I couldn't agree with you more, because we know over and over that almost any polls that are run, surveys that are done, nurses end up either number one, two, and three in terms of trust and how much people like that particular profession from a consumer perspective. Like
Yeah.
very few nurses will we have bad relationships with. So given that's the case, with such high trust and you guys do a lot of work to make sure that you maintain that trust and credibility, why is it that that nature of creativity isn't called out more? Is it because that is suppressed early on in your careers? Or is it that nurses don't think of creativity, is to just think of it as part of their job? They don't say this is or creative or not creative. Why do you feel that the creative problem solving nature of what nurses do is seen as secondary or tertiary to their caring and trust and just that bond building part?
I think it just comes naturally. You don't even think about calling it out. It's you have to be on your feet. You have to be able to, like I said, address any number of issues. I think it's just kind of nurses just kind of that's who we are. You just, you come prepared for your day, and no day is ever going to be like the next day, the day before. You have to be, like I said, always on your toes and always wanting to learn new things and new creative ways of doing work. Just because there's standard operating procedures in place doesn't mean that you can't tweak them. Kind of like my care plan going to, D, E, or F. There are definitely ways that you can be creative. And I do believe that nurses are given more latitude now. They're seen as, being very crucial. When if you don't have a nurse, on your unit, or multiple nurses, or if you're short, the whole process breaks down. It becomes a safety issue. So it's it's an incredibly important role in the hospital. But I don't think people call it out because it's what you have to do.
I totally agree. Yeah. And if you're just tuning in, you're listening to Healthcare Now Radio. This is Trending Now. I'm Shahid Shah, and I'm talking with Kelley Smith at Envision Health about Nurses Month. And we just got through discussing this very important part of what nurses do, which is creative problem solving, and why sometimes it seems like they're not often given the recognition they deserve. I wanted to bring your attention, Kelley, to a particular paper that was written back in 2018 by Dr. Melinda Ashton. It's one of my favorite titles of a paper. It's called Getting Rid of Stupid Stuff. And often, as a software engineer, I've spent many decades building systems for nurses, whether it's an infusion pump or a medication dispenser. So nurses have been our users of systems that I've built. And it just amazes me as to how much stupid stuff that they're asked to do that they just go and do anyway because they believe they have no choice. Talk about that a little bit. I don't know if you've read that paper or not, but certainly it's worth checking out if you haven't. And think about some opportunities that you've had in your career to look at something and say, man, that's just really crazy. I'm not doing it. And how did you get around doing some of the stupid stuff that nurses are often asked to do?
Yeah, there's a lot of stupid stuff. Some of the stupid stuff, though, is critically important, right? So sometimes it was very difficult to have to chart over and over and over and over, or do, every 15-minute vitals when patients clearly been stable, but the doctors don't change those orders, and you have to do it. I mean, so there's so many things like that. There's things like running back and forth to the pharmacy, and so that means you have to leave your floor, leave your patients, run down, pick up the prescriptions of the drugs. There are things like patient transport that nurses are always like, yep, come on, you can do it. We can't wait for transport. We've got to get this patient, we've got to get this patient discharged by 11 o'clock. So here's what I need you to do, nurse. Go run around like a crazy person while you're also trying to go over discharge instructions and setting up transportation. And I think there's so many things that a nurse does that you don't realize. It's not all just, you go in, you say hello to the patient, you take vitals and give some medications, and then you go to the next patient. There's a lot of things behind the scenes. There are times, I mean, nurses they're kind of like moms, like you do whatever it takes, or dads, like, if you need to go and empty the trash in a patient's room because it's overflowing, that's what you do. If you need to go change out their food because their menu was brought up incorrectly, that's what you do. So I think if you looked at a day in the life of a nurse, you'd probably be very surprised at the number of things. It's not very glamorous. It's very important, but it's not very glamorous.
I hear you. Yeah, the versatility just never ceases to amaze me. Is that when we were putting out systems, we used to come into hospitals often, and you'd see these notes on computer systems, and those scribble notes: "Don't do this, do this, and do that." And we're like, "Who is that for?" I was like, "Oh yeah, this is Nurse A telling Nurse B how to actually use the system, which is different than the way that the designers designed the system," right? And so talk a little bit about that. Is AI, or is the digital world, things that you guys have been using with EHRs, has that made the world dramatically better, or just marginally better, but you still have a lot of stuff that you have to deal with because our systems aren't quite there yet?
I'd say it's definitely better because I came from a world of paper charts, right? Everything was written down. We had a few things that you could look up online. But I think the EMRs are so complicated. I've been through a couple of Cerner and Epic EMR implementations, and especially the Epic. I mean, I can't tell you how many physicians would say, "Come here, you got to put these orders in for me." I'm like, I can't. Like, I'm not allowed to do that. Like, no, I'm not doing it. You have to do it. So in some cases, it's it's obviously come a long way, but I think there's a long way to go. I do think that AI is going to become more and more important. I think it definitely plays a role. But when you talk about nurses, AI can't provide empathy, right? It can't provide that personal connection. I think it can help streamline some processes. I think there's a lot of some of those like stupid stuff things that maybe we could take out of the system. But I think the whole AI thing is it's moving so fast that I do think from a clinical perspective, we have to be really careful. In my role, as we work with tons of healthcare IT companies to do the marketing and PR. I think it's incredibly valuable, and I think if you don't jump on the bandwagon, you're going to be lost. But I do see where there's still some hesitancy in medicine to fully use that. But I have also seen a lot of studies that it's remarkable, like these very unique diagnoses, and trying to figure out like how to treat them using AI. They're coming up with remarkable stories of huge wins because they're just pouring tons and tons of data, into these algorithms and coming up with drugs that are created for one purpose, but they are finding that they're very successful, in treating other conditions. So it really is exciting to me.
I totally agree, and I think that one easy thing we're kind of like leaving a low-hanging fruit might be to help digitize you guys. Like if you have 10 nurses, to have a digital twin of each nurse that has their own voice and the way that they do things, to allow patients to ask questions. Like, I'm sure you've seen the same, 10 patients during the day ask the same question 20 times, right? And so those kind of empathetic responses, I bet the care companions, that even it could be called, this is the Kelley twin and the Janet twin, et cetera. To me, those seem like good things for us to try. Have you seen any cool technologies that you're thinking about? They're like, oh, I didn't even think about that coming in the AI world.
It's funny you talk about that digital twin. There is a company that we're hoping to work with, and that's exactly what they do. They'll like videotape a physician or a nurse or other clinician for 20 minutes. They'll look at your movements, your tone, your voice, and then they can program this to actually, so it'd be like me calling up and saying, "Hey, Kelley, I need to know what to do to help with my congestive heart failure." my legs are swelling and I'm having difficulty breathing. What should I do? And they're using AI to have those answers, but it looks like it's coming from me.
Hmm.
It's incredibly realistic. I think there's going to be lots of opportunities like that will help the patient.
Yeah, and that's really what I love hearing, especially from nurses, is be careful is a good phrase, but hey, even though you're going to be careful on some of these things, there's an enormous amount of things that you could do for us that would actually help our day. And in the last couple of minutes that we have, that's what I'd like to focus on is what's something that you think that only great nurses do, like, that's rarely written down, it's not part of any, common care plan, but only great nurses do.
I think the number one thing, and I know this is a theme, but is to provide empathy and to get in and understand the patient and get them to trust you, right? My husband for years has always said, Kelley, you're a talker. You can talk to a rock, but somehow you can get that rock to talk back to you. And that's kind of what I always hope to do. I would go in the patient's room and really help them understand, like, I am here for you. I'm your advocate 100%. I will go to bat for you. I'll stand up to those physicians, who don't always have the time to spend with the patient. And some of them don't always have the greatest bedside nurse or manner. So I think that's really important. And it's funny, when I was thinking about this, for our company, Tim and I kind of created our mission, if you will, or our vision. And there's three things. And I thought how relevant this is from nursing to my company, because like number one is collaborate from the heart. So you've got to practice that empathy. You've got to put your place in yourself in their shoes, understand how scared they are, don't really know what to do. This is all a lot of information coming at them. And then be present in the moment. That's our second one. So if I'm with you, I'm with you. And I'm not going to be multitasking and doing other things. I'm going to be present and I'm going to be listening and talking to you. And the third one is pursuing excellence. And I don't know any nurses that don't always want to get better. You want to know what's coming down the pike. You want to make sure that you're always on the forefront of, innovation, because that does, the patient's the most important part. And that is something also I've learned in my company now is I often go back to our clients and I remind them, you're in healthcare. I know you're in healthcare IT, but you're in healthcare. And the most important thing here at the end of the day is it's got to be about that patient. And sometimes we lose sight of that, and medicine turns into so much of a business rather than, helping these patients from, to go through these very difficult times that they're in. But I think the nurses that's what they're good at. They're very good at multitasking, when they don't have to be present in the moment. They're very good at making complex situations simple, telling stories to help the patients feel, confident to ask those questions that they need to ask of the physicians. I obviously, despite the fact I'm not practicing right now, I'm a huge proponent of nurses. Whenever a family member is in the hospital, I go right to the nursing staff. I'm like, all right, we're going to be friends. Like, I get you, right?
Fantastic. Now, I think, and just before we let you go, and the last question I have for you is, given the fact that they have to be multitaskers and we're all being asked to do more with less, obviously we don't have all the staffing that we need. How do you think great nurses create time and presence in environments that basically steal both? So what would you recommend to younger nurses or to nurses that are growing in their careers to create time and presence in as easy a way as possible? And if AI is the answer, that's fine too.
Yeah. I mean, as much as you can use AI, I think it's a wonderful tool. It's also a great learning, tool. But I think you have to make like a practice like purposeful presence where you have to kind of take a step back in your day and think, I can tell I'm overwhelmed. Nursing is very stressful. So you have to even like have the confidence and the courage sometimes to tell your staff or your bosses, like, I need some space right now. I need to walk away. I need to go for a quick walk. I have to have a break. And also, I think there's a lot of camaraderie between the nurses and the physicians. And I think that's really important, is to go in and know that the nurses have your back. And if you're having a tough time, you can always go to one of your fellow nurses, and find that help that you need.
Love it. So Kelley, thank you so much. I know you're like a modern polymath here that can do so many different things. But thank you so much for your insightful perspectives, especially on Nurses Month. But more importantly, the important roles that nurses play in creativity, problem solving, and other areas. To our listeners, thank you so much for joining us on Trending Now on Healthcare Now Radio for this very engaging discussion. Stay tuned for more episodes where we explore the latest trends and innovation shaping healthcare's future.
Thank you so much.